Okay, I hope everybody had a good lunch and enjoyed the speaker. We're going to go ahead and get started. It's right at 1 o'clock. On behalf of Flagler Cares and One Voice for Volusia, welcome to the 2021 Health and Human Service Summit. My name is Kelly Knott, and I will be the moderator for this session. You have joined the session titled Cultural Competency and Health Equity in Public Health Practice. All participants will be muted during this session. There will be a Q&A time at the end of this session for you to pose questions. You may raise your hand using the reaction button at the bottom of the screen. We will then call on you and allow you to unmute yourself. You may also submit questions during the training in the chat box, and we will pose them to the trainer throughout the session and at the end of the session if time allows. If you have requested CEUs for this session, please make sure that your camera remains on throughout the session. Thank you to the sponsors who made this event possible: Advent Health, Career Source Flagler Volusia, SMA Healthcare, Magellan Complete Care, Department of Children and Families, and the House Next Door. It is my pleasure to introduce your trainer for this session, Venise White. Thank you.
Thank you. And my disclaimer, everyone, I have two screens, so if I toggle, I am looking at the gallery as well as the slideshow that you have before you. I hope you all are ready for some conversation about cultural competency and health equity, as this has been a topic for the last 2 years. I guess last year didn't count. It was a blur for many of us in public health, but I do want us to focus on cultural competency and health equity in public health practice. I usually start with a question. If we are really to close the gap in disparities, most of us in this field, we self-select to be people. Are we all hopeful that we can close the gap in disparities without having a discussion on how we're defining disparities by a show of hands, or for those who have their cameras on, you can nod or make some facial expressions. Do you all, I see Tiffany nodding already. How much hope do we have that we can close disparities? I didn't mention any specific disparity. I'm just leaving it open to disparities in public health. Okay. Today's training objectives, we will review for many and for other, clarify definitions relevant to understanding the following: diversity, race, ethnicity, culture, cultural competence, health equality versus equity, health disparities, and inequities, as well as some of the inequalities. Through sharing, we will discuss lived experiences and shared experiences related to cultural relevancy and the need for culturally competent services, not only as public health providers, but also being residents and neighbors. How do we exercise cultural competency when we're shopping at Target, as well as if we're offering WIC and mortality services within the health department, or if we're offering any type of services to a customer or client. We will identify strategies to increase cultural awareness. Please use the chat, feel free. And as I mentioned, I do have two screens, so Kelly will assist if there are some chat questions that I need to address that I may miss from talking back and forth. Diversity. I think we all can agree that we can look at the screen and I can see that James looks like James. He looks different from Tanya. Tanya has similarities with Emily. I can imagine, her camera's not on, but I can imagine. I can guess that Lisa is probably female gender. We can make a lot of guesses and generalizations based on what we see. I can put you in boxes based on the last letter of your first name. We can alphabetize you. We can put all the zodiac signs in a category. I can also categorize you by Android users versus iPhone users. So we get diversity. We get putting people in boxes. But today we will talk about how are we addressing diversity and how are we bringing people together so that they can all have the best health outcomes as individuals and as a community and overall. And if you see the categories, this list can go on. And if you see any category that's not listed, go ahead and drop that in the chat. We have physical ability, sexual orientation. Some people are now using the pronouns after their name. So we get diversity. Now let's deal with self-awareness and biases. And I'm going to bring your faces back to my main screen because I like to interact with you all. If you do have the capability to turn your camera on, I do ask you to do this because it is engaging. If you're familiar with Myers-Briggs personality typing and communication styles, I am an ENFP, so I am very extrovert. So your energy matches my energy, but I know there are a few introverts that would prefer to stay behind the screen, and that is okay. We'll meet everybody where they are. So let's own up to some of the biases and the implicit biases that we talk about. If I was hosting an event and I had to offer, and we're approaching summer in the hot months of Florida, and I had to purchase beverages. And it's midday, so I'm guessing coffee or tea. How many of you would prefer coffee versus tea? Let me see a show of hands or in the chat. So this is, you're raising your hand for coffee. Let's do coffee first. And I'm bringing you guys back over to my main screen. Or my coffee drinkers. What about my tea drinkers? These are your two options, coffee or tea. So I know some of you are like, well, where's Pepsi and other beverages? Nope, I'm giving coffee or tea. All right. So we have exercised without hesitation our preferences, which is fine. If I was to say, let's all focus on healthy drinking, rethinking our drink, which is a national campaign for healthy beverages, and we're going to offer water. And I have 3 choices of water, and I will mention them so that you know how to vote. Zephyr Hills, Dasani, and whatever's on sale, which is probably the Sam's Club version. So in order, if you prefer Zephyr Hills, let me see your vote. And we're just talking about water, non-threatening choices. What about Dasani? Let's see, okay. Let me see the Dasani again. And you all know how to use the raise hand feature or the reactions at the bottom of your screen if you can. Okay, great. And then we have, okay, at the bottom of your screen, let's do this real quick since we have 2 hours together. At the bottom of your screen, there should be reactions. And you have the opportunity to congratulate or raise a hand. I want you all to be interactive here. All right, so we have those who prefer Zephyr Hills, and we have those who prefer Dasani, which tastes like dirt. And then we have those who would prefer, because we're government, most of us, or we're grant funded, taxpayers' monies, and we have to be a good steward. We're just going to buy what's on sale at Sam's Club. Where are my bargain shoppers? As long as it's cold and wet, that's what I'm drinking. Okay. So it is okay to share and to speak up for your preferences. I did something, I made a comment when I asked about those who wanted Dasani. A few of you made a reaction. Can someone turn on their mic and comment, and if you can share, what did I say about Dasani after I expressed my preference for Zephyr Hills? Kellis, I think is it Kellis? Are you trying to unmute? Okay.
I have to unmute, I'm sorry.
Thank you,
So
Kelly. Yes.
let me try to find, it was Kellis.
Yes. Let's see if I can do it. Nope, I can't do it.
Okay.
Sorry, I have the mic, so I'm just a priority today. Okay, there you are, yes.
Actually, it's Kelly's, and as is my last name, but that's fine. Yeah, you said it tastes like dirt. And I honestly don't know which one I would have picked, but I thought, oh, I like the bottle. So that's why I picked it.
So, anyone else wanted to mention? Okay, is that, I see someone drinking water. Is that a Zephyr Hills bottle? Zephyr Hills, that's my choice too. You're my man. You're my people. You guys are my people. Yes, you're my people. Now, back to my comment about Dasani tasting like dirt. How many of you agree? Who had a preference of Dasani? I think it was maybe one or two of you. I mean, that liked the taste besides the shape of the bottle. Okay. And I think that's Ray. And forgive me, sometimes you have initials and nicknames and acronyms on your name tags. Ray, is it possible that you can unmute and share your reaction to my prejudice comment about your preference tasting like dirt? And if not, that's okay. We'll give you a minute to unmute. If not, we'll hear from someone else. All right. So I was being culturally competent and respectful when I shared my preference. Where I went wrong is when I insulted other people's preference. So when we make decisions and choices, we do have the flexibility, the opportunity to express our preference, whether it's, for dinner, are we going for Chinese or Italian? Chinese, Italian. We're in Chinese. We're going for Chinese dinner. Yes. How many people prefer Italian? And that is okay. These are your preferences. And we're doing something easy as where we're eating versus what we're drinking. But when we cross over and say, well, those who are going for Italian are stupid, or what idiot would like that, or Chinese is better than your choice, that's when we start exercising in our negative position of a prejudice. Does that all make sense? Because if we can't get past this slide, we're going to have a difficult time moving into the good stuff. All right, so I'm going to keep going. So we can own our implicit biases, and those are sometimes when we make decisions or make judgments, and we can based on our experiences. It's what we do with that information and how we treat others with our decision and our preferences is when we cause discrimination, or when we operate in negative outcomes for other people. All right, let's get to this slide. Now, race and ethnicity, are they the same? Okay, of course you can see the slide and it has two different definitions, but race and ethnicity, they are not the same. How many of you have seen pie charts or data presented where they have race and ethnicity? So you'll see a graph that may have Black, white, Hispanic, and it adds up to 100%. Typically, it doesn't add up to 100% if you do the math and you pay attention to that data. Did you know that you can be a Black Hispanic? Did you know that someone of Hispanic ethnicity can also choose the race box? So let's look at the definition of race and ethnicity. Race is a social construct used by scientists and the general public to identify groups of people based on a sociological designation and their outward physiological characteristics, such as skin color, hair texture, facial features, bone structure, and the like. And I just want to say I'm originally from Washington, D.C. And when I moved to Florida and I put new hair products in my hair, I get this curly thing going on because of the strand of hair that I have. I am often spoken to in fluent Spanish based on my appearance. Hablo español un poquito. All right, I think I switched to hablo español un poquito. So I can speak a little Spanish, but because I speak a little Spanish does not indicate that I should check the box on Hispanic, nor should the person on the other side of the table that's probably offering me services, they should not guess that I am a Hispanic woman. Similar, if I present with darker skin, I should be allowed to check which box I identify with my race and ethnicity. And I'll go ahead and define ethnicity for you. It's a category of people designated by inherited ancestral, social, or cultural national experiences. And I'm going to show you something on the next slide, but let's go back to that story I was sharing. So when we ask someone, and we do this a lot, especially when we're in public health services and we have to fill out the demographics form. What's your first name? What's your last name? Please print. Can you check a box? What's your household income? What's your race, ethnicity? Okay, Hispanic. And then we're done and we don't check a race. And then we put out these reports and we identify priority populations. But when we look at how we collected the data, it's sometimes biased based on our assumptions and our generalizations. When we're asking race and ethnicity within public health services, it is a self-selected box. There are times where I would see a name and I'm scanning the names here, but there's when I see I've heard this, and I do not see a Rodriguez, but I see a Velasquez. We do this. We'll see a name that we make a generalization about, and we stereotype and we say, well, if it looks like a Spanish or Hispanic name, I'm going to check the box for them and say that they are Spanish speaking, not taking in consideration that they could have married into that last name, or that they are not, or they may not identify and self-select as a Black Hispanic or a white Hispanic. So when we are asking folks to answer that question, it should be self-selected by that person. So 2020, the census went out. And if you pay close attention, because I hope you all completed your census for everyone in your household, we have increased the number of race options. I want you all to look at the first box, the instrument that was used. And it was interesting for me. Cultural humility is the ongoing learning of cultural competency and all relevant terminology and practices. So I'm always learning, even though I'm certified as a cultural competency trainer, I am always learning and expanding my knowledge and my practice. Because there's some days I don't feel like I want to be culturally competent. I want to operate in my zodiac sign as a Sagittarius and just, be a badass. But we're going to be culturally competent when we can. So look at white. Do you all notice something in the small print? The examples, anything stick out? All right, let me go to the next one and maybe this will help you. Black or African American. For example, and here are some examples: African American, Jamaican, Haitian, Nigerian, Ethiopian, Somalia. Okay, I know some of you may not have skipped the geography classes in high school, but if I remember correctly, Egypt, Nigeria, Ethiopia. Are they all they're all in Africa, right? Are they? All right, somebody's Googling it. Okay, I see the chat lighting up. Let me see if I can multitask here. Oh, okay. Oh, this is great. You guys are all in the chat. I'm sorry with my screens. I've met a lot of great stuff. I've met white Jamaicans. Yes. Yes, so have I. And I'm just looking in the chat. Egypt is in Africa. And some of the other places that indicate and nudging someone to check the box for Black or African American, those are also in Africa. Yes, this format, this is the actual census document. You can bring it up, you can Google it. This is the actual document. And then you have and then with the document, there's some additional narrative at the bottom of the instrument tool that you can read. But someone coming from another country where we're forcing them to check a box with information like this, you can see how this can become very confusing. There are Blacks on every continent that identifies with Irish, German, English. Yes, yes, correct. But when you read this document, you see how this can become confusing? It's saying if you're Egyptian, then you will indicate white. If you are from those other locations, and you can have a different phenotype based on the definition of race, how do you self-select which of those races you identify with? And then to complicate things more, look at the additional race options: Chinese, Filipino, Asian, Indian, other Asian, and then they give examples: Vietnamese, Korean, Japanese, Native Hawaiian, and others. And I've been doing some work with the COVID-19 response, and it's always interesting when you have someone presenting with a passport because they're newly arrival to the US, and they're trying to understand the system of identifying race and ethnicity, which is needed when we're trying to prioritize funding and set up priority testing and priority distribution of vaccines to those communities that show a lower response rate in testing and or any services. But when you look at, and I'm gonna, let me mention this at the end here, but when they asked a question about ethnicity, this is the actual document. You're either Hispanic, Latino, or Spanish origin, or you're not. I've talked to people from other places, such as, and I think Nanette had mentioned, Irish and German. Some would say those are ethnic groups as well. Would you all agree? There are other ethnicities. Yes, there are other ethnicities, but with our federal document, it only asks if you're Hispanic or not. And then recently I've seen this. I'm not sure if any of you have seen this, but this was an actual state document, and they've increased the ethnic response to Hispanic or Haitian origin. Have any of you seen that? So I always say in public health, data in is data out. So we have to be mindful when we're running reports or we're setting up priority groups that we're paying attention to race and ethnicity, but more important, relying on stratified race and ethnic groups is less important than directly assessing the specific factors and the I refer to that group membership as cultures and values and beliefs that put one at risk or put someone at a disadvantage that we see in those disparities. So culture. Culture is a shared design for living, shared norms, values, worldviews, and practices of a society or group of people who interact over time together. So you can have similar values and beliefs as someone from a different race and ethnicity. That your being culturally aware is not only being aware of, again, as we said, of your own preferences, be careful of your prejudices, but your preferences, being aware and observant of similarities and differences among cultural groups. For example, someone could grow up in a community of a different ethnicity of their own and race, and they may have similar values. We adopt our values and our worldviews through our religious practices, our worldviews on things, even the culture of different political groups or culture of different age groups. We have, and we joke about this all the time in the workplace and in general, that millennials, that's a whole different culture from baby boomers and others. So just because you have a shared race and ethnicity, that does not indicate in homogeneous characteristic of that group of people. And I'm checking the chat here. I'm going to share a story with you regarding cultural competence. We talked about generalization, which we usually generalize to get to a starting point. I generalize, I see a name, it's familiar to me because every Emily that I've met was of the female gender. So I'm going to generalize that Emily is of the female gender. My stereotype is that every Emily that I met was mean. So the stereotype is now all Emilys are mean. And if I did not get a chance to meet Emily, I would already stereotype her and leave her in the box of all Emilys are mean. And I'm using safe examples. I'm using friendly examples, but we do this with other groups of people all the time based on what we've seen in media, based on what we've experienced. Thank you, Harris. And the slideshow will be uploaded. There is one that's uploaded now for those who have to leave, but the one that you're seeing today, I've added a few other things just because of additional relevancy. And I wanted to make sure that we have a good use of our 2 hours together. So the stereotyping. Here's the story. So my mother, we identify as Black, African American today. That may change tomorrow, how I identify or what my answer choices are. Sometimes you identify as one and then the terminology changes on the document. So at one time, many years ago, I probably would have checked the box Negro. At one time, way back, I may have checked the box colored. Today, the box said African American. Now the box says Black. So the names and terminology change, but what's important are my values, my beliefs, and my practices. So my mother was in the emergency room, and I just happened to be there during the nurse's visit. The nurse was a young, and I say young, maybe early 30s, late 20s, white male. In the documentation, in the nurse's notes, I saw that there was an indication that my mother was refusing to take her meds, or it was something about non-compliant refusing, and that she was aggressive. the medication in her, the medication that was given during her condition, it could have been a fatal situation if I was not there, and I'll share why. When I asked the nurse why he's indicating that my mother is aggressive, if she was incubated. I mean, well, she had a tube in her throat. So I asked the nurse, why did you say that she's aggressive? What behaviors demonstrated that she is aggressive and non-compliant with services? And his response was, she's grog. She just seems agitated. And I asked, and this was during COVID. This was not COVID related, but this was a time during COVID. And I said, so my mom is here in an unfamiliar place. You all have on Star Wars masks, because at that time we didn't know. So they had the mask with the double chambers. And she was in an unfamiliar place. And I asked, before I could continue my sentence, but the sentence started out as such, do you understand her culture? And my next part of the comment was going to be, or her personality, because she's a feisty woman, which is her personality. Not that she's aggressive, but she's feisty. And he said, wait, I work with all people of color. I work with all people of all races and all ethnicities. And I said, that's not what I was asking you. And I'm glad you do. As a nurse, you have to do that. But my question is, how do you know her personality to assess if she's just being herself or if she's being aggressive and non-compliant? So he paused, which showed me that he was at least listening to what I was saying. But what was happening, his experiences, and sometimes we refer to these, and his actions, sometimes we refer to these as microaggressions, were not intentional, just African-American woman not being pleasant or cooperating, and the cooperation was due to her medical condition. We're not going to give her the services that she needs. It was easier to say that she was refusing care, and let's continue to sedate her. Continuous sedation in people of color, if you look this up, it's at a higher rate. And I believe some of that could be due to generalizations and stereotyping of people of color, or even with different genders. There's a belief that there is a higher pain tolerance for some people. There's a belief that, let's just leave that belief there, because I don't want to get off too much topic. But by staying there and talking with the nurse, and I explained to him, it's not about race and ethnicity. I'm talking about my mother's feisty personality. So when I explained to the nursing staff, and I said, even on a good day, she's going to be a little feisty. And we kind of laughed about it. But they then understood that she was not presenting as an aggressive patient. She was just showing her true personality as a feisty woman, not an aggressive Black woman, but just a feisty person. So I shared that with you. Being culturally competent is having an awareness of one's own cultural identity, but first your own preferences, biases, and prejudices, but also having views about differences and the ability to learn and build on the varying culture and community of norms of others. Again, allowing the medical staff to understand my mother's worldviews and her practices and her beliefs, and being respectful and responsive to those practices and those health beliefs, and then providing cultural linguistic services and needs to diverse communities to bring about positive health outcomes for everyone. I'm going to take us into what I shared earlier. Being culturally humble is suspending one's own knowledge, pride, and thoughts about a person. And this is really hard because the media, they do a great job of portraying different characteristics of groups. And where we go wrong in this is it's okay to generalize, but we have to open that door to have continued conversation to understand individuals and their culture. Being culturally humble is a lifelong process. So after today's session and you receive your CEUs, and some of you may have heard my presentation before, I've done these all over the state of Florida. We do not become culturally competent and that's it. But it's a lifelong process of self-reflection, self-evaluation, and a lifelong journey to learn about others' culture, but also exploring your own beliefs and cultural identities. After seeing the many races and very limited ethnic groups, I asked my family just to learn more about my historic lineage. So I did not get a gift to, what is it, ancestry.com. So maybe if my ancestry is from a different part of Africa, then maybe I can check the box for white. Or maybe I can check the box for some other ethnic group. But that is part of the cultural humility and ongoing learning, not only of others, but of ourselves. Cultural sensitivity. It is not understanding the other person. Let's see, we currently have 45 participants. I'm going to generalize that we have a higher percentage of women because my experience tells me that more women than men self-select to participate in cultural competence trainings based on my experience. I could be wrong, but that is my generalization and my hypothesis. So if I received grant funding to come up with, let's say, a hair product campaign, will all of the women on this training, could we come up with a campaign in maybe an hour? Because we all have the same hair care needs, right? I mean, as women, the guys are probably like, yeah, just give them some shampoo and conditioner and let it be. Women, could we come up with a campaign for all women within an hour? No, we don't have the same needs, but we could come up with, yes, Tiffany, yes, we will come, as women, we will come up with something. But even with a homogeneous group based on gender, one characteristic, we do not have all the same needs. We do not have all the same experiences. Some will share experiences that I probably would not understand. Having an awareness and respect for a person's belief and their priorities and their needs, that is when we exercise cultural sensitivity. Mother's Day just passed, and my mother is still with us. I can respect and sympathize and empathize with those whose moms have passed on, but I don't understand it because my mom is still here. That's not my lived experience. But I can still be of assistance. But to say that I understand your story, or I understand, we say that a lot and we don't understand. We should get to a point of just respecting others' views and experiences without denying lived experiences, and just getting to a place of respecting their beliefs, their values, and their experiences. So our culture and cultural identity, as I said, we can all check a box for race and ethnicity. We could check a box of other categories as married, single, divorced, widowed. We can check a box for your sector that you work in, nursing, academia. We can check a box with a lot of things, but our shared cultural views, and when I say culture, I'm referring to all things that make up how you make decisions, not just your historic background. And where do we get those ideas and views from? If we had time, and if this was in person, I would break you up in groups and we would talk about some of those experiences. The community where we grew up. If you all were to close your eyes, and let's just do that. Close your eyes first. I'm gonna keep my eyes open because I got my eyes on you all. Close your eyes. I want you to think about a good time in your childhood when you're out playing with your friends. Did your friends all look like you? What did your friends look like? And let's just pause right there. Come back. Starting with something as simple as your experience and where you grew up. Were all of your friends the same? Were they all of the same gender? The boys played with the trucks and the girls played with the dolls? How we grow up and those characteristics that we are taught, they have a great impact on how we become decision-making adults. Those are things that build our values and our worldviews when we express our preferences, but also those are the things that lead to our prejudices. Our historical and social experiences. And what we're hearing more about with the hesitancy with COVID vaccine in some of the communities, how those historical experiences have been accepted or acknowledged has a great deal. See Tiffany play with the boys in the neighborhood. Yes. Yes, my best friend was African American. So Ray, going back to, and I'm saying Ray because it says REYIAC, so I'm giving you a nickname. I took the opportunity to do that. I've seen statements, and this was actually my son. My son is now 22 and he was in, so this was about 17 years ago. There was a family and my son, we lived in a mixed community. And I remember this one family, because kids bring families together more than ever I see these days, especially if they play intramural sports or recreation. And this family said, hey, my son really enjoys playing with your son. We've never met a person of color, of African American or Black, where they're from. And I said, okay, I was trying to fill out where this was going. And she said to me, do you all know Little Bill? It was, I don't know if this is safe to say now, with the situation going on. Bill Cosby had a cartoon show and it was called Little Bill. So it was a little Black kid. I think it was Nickelodeon, one of those children TV shows. It was a cartoon. And this family says, well, besides Little Bill, so she made reference to her experience with other or people of color with a cartoon. She said, well, your son is nothing like Little Bill. So I'm thinking, this is the first time that her son is playing with a Black friend, and their only reference point is Little Bill, which is a cartoon of a Black family. Imagine the generalization and the stereotype that they were leading that family into if they had not diversified their surroundings, or not that they had to diversify their surroundings, but imagine the stereotypes that are created when you're not exposed to other spaces and you're not open to other. And Susan, I want to come back and read that. I see bits and pieces of your comment in the chat. Imagine when we're not open or we do not have diverse lived experiences. And I'm not saying, and I've heard this too, and I'm sure during February, you in your workplace or in your community, there's a Black History celebration, as well as in the fall, there's the Hispanic Heritage festivals, and then you have the multicultural awareness. So where they have the taste of different ethnicities, which we love. We love eating, we love doing the dances, we love going to museums, we love being exposed, but actually meeting someone and learning more about them, we do a disservice by saying, well, I watched that on television. In college, I had a friend from Ghana, and I had, going through my cultural humbling experiences, I remember our professor saying, you know, you two girls are, you know, top of the class. I want to take you out for steak. I mean, we didn't go, you know, students, professor, we didn't go, but he said, I'll take you out for steak. And he made a comment and said, to the friend from Africa, would you eat your meat raw? And she laughed. And I said, well, why did he say that? And then I had to own my own ignorance. And I said, well, she made the comment, he probably thinks because we're in Africa, we live in huts and eat raw meat and hunt our meat. And I said, wow, I didn't think about that. But then I said to her, but do you guys live in huts? My ignorance, because my reference point for Africa growing up was National Geographic. So my reference point limited what I thought, but without having comfortable conversations with other people, that could have went really bad. So let's see, Susan says, I am white, name is Korean by marriage. I started first grade in the first year of integration, and my best friend was a sweet little Black boy who sat beside me. My friends were a very diverse mix and still very high contrast with my older sister who was, yep. Again, your upbringing, your beliefs, education, family makeup, socioeconomic status, those all have a great impact on how we see others as adults. And I have a slide about ACEs. If you're not familiar with ACEs, I'm going to bring that slide up. Thank you, Susie, for sharing. And Yvette, many were in my home neighborhood, but not at school. Had a mix of different friends, which I now appreciate very much, having had the exposure to different cultures. Yes. And trying new things. So adverse childhood experiences. How many of you all are familiar with adverse childhood experiences? Have you heard of ACEs? Okay, a few of you, yes. And this has been some, I won't say recent findings. I think many of us knew this all along, but it's now just becoming documented science that your childhood experiences have a great impact on your success as an adult, not just your health outcome, but also criminal activity, mental health activity, continued, they use the term household dysfunction, abuse, and they stem from abuse, neglect, household dysfunction. And I just read somewhere that they're also including your racism as an experience and how that leads to outcomes of your ACE score. But did you know that those children who are impacted become us? We're the adults. I love when I participate in those ACE workshops and we say, oh, those poor little kids with all those problems, they must grow up to be criminals, and what can we do for the kids? If you look to the left and look to the right, those kids have now become your peers, and we're still dealing with some of the outcomes and trauma that was not dealt with as children. So I just wanted to bring that part up. But social determinants of health. More than the healthcare system, where you live, work, play, worship, all of your experiences, they have a greater impact on your health outcomes than access to health care. As we know, as we mentioned, those categories that we can put everyone in a box: age, sex, hair color, zodiac sign, communication style. We've got so many categories that we can put people in. But your individual lifestyle factors, and I'll share one of my personal journeys. And as you can see behind me, I have some medals. I'm going to tell you a little bit about those medals behind us. But your social environment, your community networks, your friends, your neighborhood, the Boys and Girls Club in your community, the church that you grew up in, and then the living and working conditions which contribute to your social economic status. Those all lead up to an overall system of wellness in your built environment. And here's one of my favorite pictures. And this graphic, which I love it so much, I have it poster sized in my office. Elements of a healthy, equitable community. And this is from changelabsolutions.org. They've got fabulous graphics that help paint a picture, especially if you're talking with different sectors about social determinants of health, where there's an understanding that transportation system, access to healthy foods, education and quality schools or the lack of quality schools, affordable housing, the quality, the air quality, sustainability of the environment, location of parks and community spaces, economic development, homelessness, unemployment, and wages. We could spend a whole day talking about inequalities within the workplace. And then health and supportive services. All of those elements contribute to health outcomes. And as we see, we hear about affordable housing, and we hear about discrimination in the political system or criminal system, and other inequalities that we've seen. These all impact mental health, physical health, economic security, safety, community cohesion, as well as civic engagement. So how many of you all have seen this slide here? This is borrowed from Robert Wood Johnson Foundation. It's one of my favorites to demonstrate equality versus equity. So I am now a cyclist today. Well, this month it's National Bike Month. So to my fellow cyclists or bicyclists, get your wheels rolling. So my preference, if I had to come up with a public health program to decrease the lack or to increase physical activity, based on my experience and my preference, I'm giving you all a bike. And my favorite color is pink. It really is. So you all are going to receive a pink bike. And I'm going to ask you just to ride your bike 30 minutes a week, because we're busy. Just 30 minutes a week. Would you all comply with me? Could you all ride the pink bike 30 minutes a week? I see one head nod. Okay, thanks, Susan. Susan's on board. All the Susans, both the Susans. So maybe there's a generalization that Susans are compliant. No, just kidding. But I do have two Susans who agree. Yes. Lisa, thank you. Yes. So I'm going to guess the rest of you are just lazy, non-compliant. But since this is public health, hey now, I like that, Nancy. I like that. Yes, I want to hear from the people who did not agree. And it could just be that you have a disability, or your preference is not biking. Your preference may be swimming, or maybe There are no sidewalks in your community, or there's no safe place to ride along a trail. So your preference may just not be biking. Maybe you wanted something else. Or maybe you wanted your bike to be purple or blue or whatever your preference that you need to be successful in riding your bike 30 minutes a day. But I'm also giving you all helmets, and today I have big hair day, so your helmets will be fitted to my head shape for today. Will you all wear the helmet that's given to you? Because we do have to be, sorry, missed questions, 10-second distraction. Okay, no problem. Yvette, we're just going to give you the bike. You're going to ride the bike and you're going to ride the helmet because you weren't paying attention, and we're going to give you what we think you need. Sounds like some of our public health campaigns that we do. No, I need my own. Yes. Yes. So equity is asking you, folks, I need you all. The end goal is to be healthy, to be physically active. The goal is to exercise, or some people don't like the word exercise, so we play on words with health literacy, to be active. We need you to be active for 30 minutes at a time each week. So maybe we can, and going back to the bike analogy, you may need a bigger bike, you may need a tricycle, you may need some type of class to teach you how to ride your bike safe off the trail. But again, some of you may say, hey, I would prefer African dance class, or I would prefer Zumba, or I need something low impact. That is still reaching our public health goal of increasing physical activity, but removing my personal agenda of giving you all a pink bike because that's what I like to do. And then assuming that those who will not meet that goal, there's some negative connotation, and that way and you'll just be non-compliant. Or with my example with my mother, for those who didn't turn on their cameras, they're just being uninvolved or non-engaged. The things that we do when we say about people who do not participate in programs that we plan. Sure does sound like many of our existing programs. Here's what we think you need with little differentiation. Yes, yeah. Go do this because somebody's at the table making decisions. It may not be the people who we are impacting, but just with this bike exercise, Venise is in charge. So Venise is giving you all a pink bike that fits her helmet, that fits my agenda. It's convenient for me to package the program for you. And if you don't do it, I told you so. They're just not interested. This was a session after lunchtime, so they're all sleeping, Kelly. No, just kidding. So, but we do this with programs in public health.
I actually have a question that was directed to me to ask.
Okay.
Is now a good time for that?
Yes, please do.
Okay. So what is your take on shows or things like Blackish or movies like Medea? Music, etc. I feel like we're trying to get rid of stereotypes, but don't shows like this perpetuate them?
I agree. So my take on those shows is entertainment. It's entertainment. However, I hear after some of the performances, Tyler Perry, who is the maker of Medea, he's intentional about putting messages out there. Sometimes entertainment is just that. It makes you laugh, cry. It's just entertainment. Eat your popcorn. Don't analyze it. Get over it. But with the Tyler Perry movies and live plays, he is trying to teach messages. However, with the characteristics, we do a disservice, and just such as media. How many times have you seen an interview conducted and you're thinking, could they have picked someone else to provide what they saw in the media? There's a new show that it's very traumatizing to me as a Black woman that I watched. And if you're up to, I mean, it's definitely one that increases cultural humility, as I said. I believe it's a Netflix show and it's called Them. Have any of you heard of that? Or is it, I think it's Them, yes. Hakeem. It was very traumatizing for me. And I believe that the intent of it is to share some of the lived experiences of the past, but it's very traumatizing and triggering, I must say. So I had to turn it off. Yes. Yeah, so my take on those movies, I try not to engage in things that cause triggers for me. Blackish, as well as there's another one, I think it's called it's on the Asian family. So we have a lot of these shows that share different lived experiences of different cultures. And I think they're great to for exposure. It doesn't replace real relationships and continued learning and exchange. But what's the one with the Asian? I think it's called My Asian American Family or something. It's the offset of Blackish, but for the Asian families. All right, I don't know the name of that, but let's pull my screen back up. And it's same thing for if I was to prescribe apples, I'm going to give everyone equal distribution. You all receive the bike, go be happy. You all will receive a box, go pick your apples and eat an apple a day, keep the doctors away. But if you can't reach that same limb of the tree, then we need to give you the number of boxes. We need to give you the number of classes or exercises or subsidies for you to reach that end outcome, and that's equity. Equity is attainment of the highest level of health for all people. And sometimes to get that equitable outcome for all people, we have to prioritize those groups and populations that are disparate. To achieve health equity requires valuing everyone equally with focus and ongoing societal efforts to address avoidable inequalities. Sometimes they're not intentional, but most of the times they are historically, as well as contemporary injustices that we still see today, as well as focusing on the elimination of health and healthcare disparities within the healthcare system. A lot of times we see the disparities displayed in pie charts and graphs like this. This is one, again, where they only refer to Black and white. But as I showed you on the census, many of the documents, it's not a Black or white race ethnicity. We have others that could be represented on many of the pie charts and graphs that I see. Health disparities are the differences in health outcomes and their determinants between segments of the population. And we see those here. I don't know if you can see my cursor on the screen, but when there's a gap in the outcome, the tall person will receive an apple. The middle height person, not so much. The height challenged person, definitely not. So yes, this gap here, that is a disparity. We see this in social factors, those social determinants of health, employment rates, living in poverty, no home ownership, obesity, not active. Again, I'm giving out pink bikes to increase physical activity, smoking, and could not access a medical doctor. Again, your race and ethnicity does not directly correlate that if you are of a certain race or ethnic group that you will be impacted by these social factors. However, it's the characteristics and your beliefs and your values and your experiences that lead to those health impact and outcomes. The inequities are those disparities that are modifiable. I can give you all a different type of exercise class. I can modify the flyers that are all in English. Maybe I can put them in a different language. And I'm going to show you something on that too. Associated with the social disadvantages. So anything that we can change or we can tweak or we can modify so that we can increase healthier outcomes, that's our goal as in public health practice. and especially those that are considered ethically unfair. When we identify those disparities, we have priority initiatives, and these are just a few. I no longer use the word targeted groups. No one wants to be targeted. I like the term priority. If we have a disparity and there's one group that needs additional assistance, that's like putting training wheels on the bike for the person who needs it to ride their bike safe. That's a priority for me. That doesn't mean that if the other people, if you can ride your bike, you don't need the training wheels, but that doesn't mean that I have I'm being prejudiced of them. We're giving the resources to the people who need it the most. So here are a few of our state initiatives that I've seen over the years, and you may be familiar with some of these in your community. Florida Healthy Babies, that's a state campaign to address the infant mortality rates within Black and Hispanic families. Men's Health Month, that's a national initiative because generalization, which leads to stereotyping, says that men are less likely to see their doctor regularly for preventive. They only wait until it falls off. So that's the generalization that led to, hey, let's come up with Men's Health Month. The stereotype would be all the men that's on the call do not see their doctor. But we know that's not right, James, right? See, I can only see the cameras that are on. And then we have some other initiatives working with the faith-based community when we're trying to work with certain groups and populations, and doing, putting flyers in culturally appropriate graphics and language. There's a flyer there when we our data was showing a disparity in the Spanish-speaking community with COVID, modifying the flyer in their language. But we cannot make a dent in equitable outcomes without addressing health literacy, which is the degree to which an individual can understand, communicate, and act upon health information. And did you know only 9 out of 10 people fully understand? Well, 1 out of 10. So if I was to look at each of you on the row, for each row of 9, one of you really exercise and understand health literacy. And that's from choosing your health plan, accessing coverage, following through with your treatment plan. So 9 out of 10 people lack skills needed to manage their own health and prevent disease. Good job, Yvette. Thank you. Staying, and he cares to stay healthy for you. I love it. Yes. Sometimes we need to give out incentives and motivation based on what their interests are. This is a great example of what not to do when we're addressing health literacy or priority marketing. How many of you have seen a flyer or a banner that is intended to prioritize marketing and programs for African Americans or Blacks with this graphic at the bottom? That is what is known as kente print. We usually see that during February, during Black History Month. I often see it on ads if they are marketing and prioritizing Blacks or African Americans. But did you know that that can be insulting to some? See, I'm from Washington, D.C., and I've never taken the Ancestry.com, so I'm not sure what part of Africa I am from. But that kente print is from a specific part of Africa, not used by all people from the continent of Africa, and surely not recognizable or a reference for all people of African descent that live in America, who identify as African American. And this is not intended to insult, but without including people in the planning process or the marketing of programs that we intend to present in their community, without including them, we sometimes miss the mark and we can cause insult, we can cause injury, which will then lead to low income and low participation in programs and services, and will continue to show disparities in all of the chronic diseases that I showed you before, or some of those other outcomes. This was very interesting here. This was a flyer that it's actually a brochure that was created. It was translated from English to Haitian or Creole. So I'm not sure about the words, but we sent this off to someone, and it was a partner. Forgive me, but it's similar to like the Haitian embassy, if you will, over in Haiti, to help with the translation. I want you to look at the photographs. This brochure was going to be used in the state of Florida for the Haitian community. I'm going to pause there because I want to hear your feedback on, oh yeah, because obviously I should tell you what it's about, because I don't read Creole, and I can assume that you all can read this too. But this flyer was to raise awareness about rabies. There was I don't want to say an outbreak, but there was an increase of rabid animals in a community that is well known to have Haitian communities, Haitian residents, or I should call them Haitian Americans. So they now live here. The clinic, that is the hospital up top. Now, I've been to the Dominican Republic, but I've not been on the side where Haiti is. So I'm not sure. And again, with my ignorance of what I see on television and entertainment, I going back to asking my friend who's from Africa, do you all live in shacks or huts? Because that's what I see on National Geographic. I only see on the media when there's a disaster of what Haiti looks like when it's been a hurricane or some disaster. So my ignorance would say, wow, are all the hospitals like that? They're in Haiti. But again, this flyer is not for Haitians in Haiti. This is for here in America. So when we show this to someone who lives here now, that was very insulting. That was great that they translated the language to be relevantly appropriate, but they did a disservice with the graphics. And check out the kid at the bottom. He's barefoot. And the response was, the program managers consulted the Haitian embassy, but again, it was irrelevant to the Haitian community here. This was relevant, may be relevant to the Haitian community there. Do you all see how an attempt to be culturally relevant could go really bad? Looks scary, assumes things about the neighborhood. Yeah, about the neighborhood too. There's a lot of, and that the assumption too is that they're barefoot here. Yeah. Seems the photos were taken from an old youth brochure, not in the correct. Yeah, that's why I was putting the emphasis that they did consult with someone with the Haitian community, but possibly for the community there, not the community here. So we have to be careful when we're marketing and consulting. This was an interesting training, not a training, but a webinar through the American Public Health Association. And as I said, this is a long journey, ongoing journey, where with the COVID response, I had to learn, and I mentioned earlier how when I was first starting in public health, we always used the word targeted communities, and I no longer use the word targeted, I use priority. This was just one of the slides that was shared from the American Public Health Association Policy Action Institute when working with the community, words that we should use and words to lose. So that was interesting for me, where personal responsibility versus national duty, just looking at some of the terminology, public health agencies versus government health agencies. And I understand that some people do not trust the government. So we could be more effective and a greater impact by using safer words or non-threatening language, and even language at or below a 7th grade reading level. We have to be mindful of the language in addition to graphics. And I want to hear from you all. Are there any words that you have transitioned from using? One that I read about the other day was the word stakeholder. If I have time and I can multitask, I'll drop the article in here about stakeholder, where the first time I heard about this, in the history of using stakeholder had a negative connotation, where I actually had to look it up because I wasn't familiar with that. That's not my reference point. That's not my experience. But when you're saying stakeholder, it's typically the person who has the financial investment in the outcomes, not really the investment. Where we say stakeholders and we bring the people to the table who are impact. The history of that is the person who had the financial benefit, not the health outcome or the greatest shared impact, if that makes sense. So some organizations are declaring no longer using the word stakeholder. So I'll give you homework to look that up. This past year, we've seen many agencies and organizations before who would not use the word racism. Now that APHA and many other organizations, they have declared racism as a public health issue, we're now using language that we've not used before. So ongoing learning with health literacy and how we effectively communicate. So going back and not to mention the recent Black Lives Matter, Blue Lives Matter, and all those that matter. I'm surprised, and I haven't seen the whole chat, but I was waiting for someone to mention that. Well, if you look at a lot of the chronic diseases and talking about priority groups, if we're trying to increase physical activity, which hopefully will impact healthier eating, which then correlates to chronic diseases, we need to have priority programs. This was an article from Runner's World, Why is Running So White? And the link is there in the slide. You can read the article later, but it's talking about recreation and physical activity and how the lack of diversity. I am a member of Black Girls Run, and let me move this to the side here. Black Girls Run does not indicate Black men do not run. It does not indicate white women do not run. It does not indicate anything more than saying Black girls run. Let's just pause there. We have a lot of discussion about what lives matter and what colors matter. And I listened to a presentation earlier today, and the speaker, the consultant, gave the example of the house on fire. I saw some of you there. If my house is on fire and he gave this example, and your house and the other homes are not on fire, and we made that house on fire a priority to take the fire engine and put the fire out there, It doesn't mean that your home's not important. Just right now, my house is on fire, so that's the priority. When we see those disparities and we come up with programs or funding sources or initiatives to address that gap and disparity, that's what we're focusing on. What is needed for the healthier outcome for that individual or that community? So for me to become physically active so that I was not plagued with obesity and diabetes and some of the other chronic diseases that's associated with one of my ethnic racial group, I started exercising more. And some of the nuances, like what do I do with my hair or where do I run? I wanted to run with people they didn't necessarily have to look like me, but I wanted someone that could relate to my views and my experiences and my nuances about running. So I joined Black Girls Run. And in this picture, I had just finished my first marathon, 26.2 miles. This is when you guys can give me that congratulations thing and all that, because looking at the statistics, and I'll read this one for you. And this is out of that article. I want to read the statistics. And I look at different public health statistics, but this one was interesting to me because it talks about core runners, the sport of running. Core runners, so there was a survey conducted, and out of 12,000 respondents, and these are runners who participate in some type of registered race, like a 5K, a 10K, a community walk. Out of those who participate in regular running events, 90% are white, 5.1% are Hispanic, again, ethnicity versus race, 3.9% Asian Pacific Islander, and 1.6% are African American. And the article goes on to talk about some of the barriers to this. And one person mentioned, well, possibly it's due to, and I saw this, I was running in Miami and there was a homeless guy, and it, again, shocking my cultural competency and sensitivity. He had a sign and it said, "I'm hungry and you ran to pay." I mean, you paid to run. Thank you. And that sunk that he pricked the consciousness of my worldview. I'm running in a half marathon and I've got on like not so expensive running shoes, but I definitely had on a coordinated outfit because I like to run pretty. That's my thing, right? I have to run in pink. And his sign said, again, his worldview right in my face of my worldview. I'm homeless, but that was one of the hypothesis that maybe it's because of the cost that running is. But if you think of the sport of running, it's a pair of running shoes and some breathing technique, which is free, and some stretches, and you can get out there. But taking in consideration my lived experience, and since then I've done about 30 half marathons and a triathlon. And yes, even with my triathlete group, I was probably one other person of color on my team. Again, if you look at the statistics of the chronic diseases and you look at the statistics of those who have gym memberships and different lifestyles that lead to healthier outcomes, there is also a discrepancy. So Glam Girls Run Club. I wrote a grant to ESPN Women's Foundation to prioritize exercise or running or some type of physical activity for African American and Hispanic girls in middle and high school. So with that grant, we are now increasing the interest, their reference point, so that they can become long-term. Some of them stuck with running, some of them did something else, some of them are doing Tai Chi, and just having that exposure so that they know that they can accomplish goals and stay healthy and physically active beyond running, which is my agenda, but I just wanted to share that with you guys. When we're thinking of public health practices, or we're thinking of programs and we're thinking of initiatives, talk to the people. If you don't have that experience or that lived experience, talk to others who may have an interest. Again, I like riding a bike, but it doesn't mean that you all want to ride a bike. So I like to always summarize where we're headed from equity, disparities, inequalities. Starting from the top quadrant, inequality. We see the tree with an unequal access or distribution of opportunities, or the availability of opportunities. The trees are, the tree on the, I'll say one side, I don't know if you're left or you're right, or if it's mirrored on my end, but one side of the tree, there's an abundance of apples. There's privilege of apples falling. And the other tree, no, not so much. At no fault of the recipients, it's just how the tree has grown. It's just the way the apples fall. Now, to address this, because in public health, we're saying, well, an apple a day keeps the doctors away. What are we going to do about the people who are not receiving their apple or getting an apple? Let's have equal distribution of resources. We'll give people both a ladder, a 6-foot ladder. Did it fix the problem for equal distribution? No, they just now have the same resources with the same outcomes. But when we look at equity, the person with the disadvantage, maybe they need an additional 2 feet on their ladder. So now we left the 6-foot ladder for the person who had an abundance of apples, but we gave the disparate person an 8-foot ladder. So at the end of the day, at least there's some, I won't say it's equal distribution, because if you look at the tree has never changed. There's still a lack of apples for the 8-foot ladder to reach, but at least they're getting something. At least they're getting an apple. Not as much as needed to keep diabetes low, or not enough to keep them out of poverty, not enough to keep them gainfully employed or economic resilience, but it's something. And that's what we see when we develop programs to address equity. We provide custom tools that identify and address the inequality, but we never fix the initial problem. But this graphic at the bottom, justice. Instead of adding more length to the ladder, let's fix the tree. Let's fix the equal distribution of the resources. Instead of putting a Band-Aid. So in this picture, they've anchored the tree trunk and propped it so that the tree is now growing, and this is indicating the system is now fixing the system to offer equal access, equal opportunity, equal distribution for both tools and opportunities. So they now have the same tool, but what has changed is that the access and opportunity is now equal. Let's pause there for a minute, and any comments or feedback on, and I'm bringing the chat over so I can see. Any comments or feedback on the giving tree graphic? Tanya, I see your comment, and I did not see it when you posted, so I'm not sure which comment you were referring to about shaming for doing something.
That was when you were talking about running the race with the homeless gentleman.
Yes, again, it could have been, if I was not in a good place in exercising cultural humility myself, I could have felt shame-based. That's why I mentioned it's ongoing, because sometimes we will be in a position where we may feel, and I'm going to use your words, that we're being shamed for doing something that we prefer or love. It would have been different if I had robbed him and paid for my race entry. But you're right, that's not the case. It was my preference to pay for that race, to win that medal, to keep my body moving, because the end goal for me was to stay physically active to prevent my health outcome. So good, I like the graphic. Truly balancing the system. Okay, yes, thank you, Tanya. Tanya, did that address your comment? Okay. Okay, yes, thank you. So our need to be culturally competent, culturally sensitive is more than just putting a flyer in a different language. It's more than coming up with a well-designed plan, lacking input from the community that you are looking to impact. It's more than putting kente cloth on a flyer to recognize it for a certain group, but the need to be culturally competent public health professionals. And I have a few bullets here, and I would love to hear from you all as well in the chat, or unmute your mics. Now that racism has been declared a public health issue by many national and international organizations, we must face it. Face it in the manner with a goal in sight. The goal in sight for those in public health is typically to achieve healthier outcomes for everyone. And that's by identifying, one, standards for race and ethnicity. If we're measuring those discrepancies based on race and ethnicity, we could be missing the mark, as I showed you in some of the graphics in the slides earlier. But looking at the social constructs and the elements of a healthy community, what's needed, not just based on an area or population, but look at the community, their built environment, their access to fresh fruits and vegetables, looking at the homelessness, the affordable housing in that community, which may correlate with a race and ethnic, as we've seen in some historic practices such as redlining and other discrimination. But when we're trying to address a population and group, it's more important to look at the factors that lead to the health outcomes. Again, we have to recognize the changing population demographics. And as you see with the census document, even the choices that you can check are expanding. I'm still looking at the instruments and trying to figure out which box some of our clients and customers should check, because I'm also confused. So I can imagine they sometimes can be confused as well. Identification and consideration of health disparities. I think we all get with many of the national initiatives that there are health disparities, but again, we need to put a focus on what are those disparities and why those disparities exist. And then also having and working with a framework for decreasing health disparities through culturally and linguistically appropriate services, which we often hear as class. I saw this t-shirt and it made me chuckle. And I wanted to share this with you all, as I know many of you are in the public health, and we're all educators in whatever field that we are. And this t-shirt reads, Being a public health educator is easy. It's like riding a bike, except the bike is on fire, you're on fire, everything is on fire, and you're in hell. I know sometimes that we probably may feel this way when we're addressing public health issues. As you know, they change. We've my office, we've become the call center for COVID, in addition to the health education and trainings that we must continue, and then also keeping up with the data, how we prioritize our funding and our services in priority populations, even though the data may not help us to identify what those priority populations are. Sometimes this t-shirt sums it up, and I just wanted to share that with you. I thought it was funny, just for a comedy break. So what can we do to continue? Commit to offering high quality care to all within the healthcare system or within your practice. We do a lot of partnership with other sectors, and now with the recent declaration of racism as a public health matter or issue, there's a greater understanding that all sectors have an impact in public health, whether it's media, law enforcement, of course, the healthcare system, emergency response, businesses, all those that we've seen impact by COVID-19, they're now getting the understanding or the respect that public health is health in all policies. It takes everyone to create that equitable, healthy community at the individual level to the community level. So it may reference healthcare system, but this is for all sectors. Assist with access to healthcare, including preventive and best treatment for the individual, not based on generalizations and stereotypes of groups of people, but what's best for that individual. Consider and take into account individual and group opportunities, exposures, and stressors that cause differences in underlying health conditions. One example that I provided was my personal experience with running and biking, and providing or pulling out the barrier or the lack of exposure for African American and Hispanic girls in my county to access 5K races and participate in other group activities. But part of that grant, we actually provided scholarships for them to participate in those races and other recreational activities. And then create an inclusive interprofessional team where we have input. Many of the articles that I received regarding adverse childhood experiences either come from my colleagues in mental health or in social work. So making sure that we have other disciplines at the table when we're planning programs or activities, or even analyzing the data and of the outcomes that we see within public health. With an overall mission, we are called to advance health equity, improve overall quality, and to eliminate disparities. I'm going to leave you all with one last slide, but I think we're good on time if we want to open up the floor for comments or shared lived experiences. I leave you with this effective strategies and a charge to each of you. Exercise cultural competency. So exercise is putting it into practice. And as I joked earlier, sometimes I just don't want to be culturally competent. I just want to, say what I want to say and take off the being politically correct, but being in a position of ongoing sensitivity and humility puts me in a better position to be effective in the work that I do. Apply mutual respect and acceptance of those differences. The homeless guy, his choice was his choice, and his comments on his sign, that was his sign. I did not react or become shamed by it. but I respected his sign and I continued with my decision to run that race. And I got my medal too, got my medals back there. Recognize specific cultural practices, knowledge, attitudes, and behaviors, being cautious not to generalize and stereotype them, but just to be aware of them and recognize them, not to assimilate, but to recognize and respect. Respecting others' worldviews and shared experiences. Adapt to the cultural conditions of others. Adaptation could be simple as changing the colors on a flyer. It could be putting the flyer in different languages, or when I was at the University of Pittsburgh, we adapted to certain communities where we did not go in with white lab coats, but we went in with jean jackets. Or we hung up our designer blazer in the office. When we went into the community, we took off the white lab coat, we took off the designer blazer, and we put on a jean jacket so that we can be more impactful in delivering the messages and services that we needed to do within that community. Building a multidisciplinary capacity to reach others. If everyone on your team has the same personality, even personality, you may want to change up your team a little bit. Build it, and of course, practicing grace, allowance, and forgiveness. Well, I thank you all for your time and spending with me after lunch, and I'm still looking at some of the comments in the chat. Thank you, Tiffany. And I would love to hear any aha moments from today, or any shared language that you are now using that you have replaced. And thank you, Manuela, within this journey, as I keep emphasizing after you receive this. And if you need CEUs, make sure you fill out the paperwork and the evaluations. It does not stop here. It's ongoing, never ending, if you're on this journey to cultural humility, so that we can reach, as I said, advancing health equity, improving overall quality, and to eliminate the disparities within public health. Thank you.
Thank you, Venise. I'm going to go ahead and post our survey for the whole summit today. If you could take a brief time to fill that out. Of course, this is something new for all of us, so we would appreciate the feedback. If anybody has questions, do you want to raise your hand, or do you want me to just open it up, Venise?
Let's open it up. If it gets too wild, then we'll
shut you down.
Right. But let's go ahead and open it up.
So you can unmute yourself right now if you have any questions or comments. And while people are thinking, just thank you for attending, and you can go back to the WOVA link and look at the sponsors information and the virtual hall exhibition information. So thank you.
I just have a quick comment. I had this experience in high school, and I cheered, and we were watching a competition, and my friend and I were sitting next to each other, and I just never really looked at anybody as black or white. I told my friend, who happened to be black, that I thought the girl in the, I said, wow, that girl did a great Russian, which is like this huge, great jump. And she said, which one? And I said, the one right there in the middle. Well, the one right there in the middle was the only black cheerleader in this particular routine. And she complimented me and told me, I just am so excited that you did that. And I'm like, what are you talking about? And she said, because you did not say the black girl. And I just never thought about that person as a black girl. She was a girl on the team like everybody else and did an amazing jump. I would have never thought to say, oh, the black girl. But I have heard many people reference others like that. And we are in high school. So we're, I don't know, 11th grade maybe. during this time. And it was just amazing to me how it made her feel that that's how I addressed that person. And that was the first time I think I ever realized the impact for her with other people's reference. I just wanted to share that because I mean, I'm in my 40s, so that was a long time ago. And I think that was the first time I realized, wow, she must go through something else completely different to acknowledge me like this. And we have been friends for a long time. So I just thought I would share that.
Thank you. And I can imagine that you pricked her consciousness and changed the trajectory of her thought process of what white women or white girls said or did.
I hope so.
Yeah, yes. And going back to that slide of the characteristics, those are the most common where we give characteristics: the black one, the white one, that one, the gay guy, the fat girl. But the choice of characteristics that we use, it comes from some reference point. So good for you, yes. And I grew up where I had friends from different race and ethnicities. And at that time, we even had someone from Russia, which up north, it was either you were black, white, or that other thing. And that's just what it was, or the other, we don't know. And we didn't know. Growing up here, my sons, they played soccer, and I remember my son, my youngest son plays lacrosse. So of course, going back to Black girls don't run, imagine me telling my family that my Black son plays lacrosse. They're like, but that's another article that needs to come out. Like, what are you doing? That that's not a Black thing. Who says there's a Black thing or a white thing? So I do see the growth in our world views nationwide, but we still have a long way to go. But thank you for sharing.
I grew up in New York. This actually was in New York because that's where I grew up. So it is very different down here. I moved here when I was 20 and very, very different. But I'm just thankful to my mom. I just really owe it to her for how she raised us. And anyway, thank you.
You're very welcome. Anyone else? I see, let's see. Words matter, yes. Words matter, they do. I shared this with you since we have a little time. One of my favorite authors is Maya Angelou. And in one of her books, don't quote me word from word, but here's the scenario. I love storytelling because of my personality. In the book, it was during a era with the transition of hairstyle. So at that time, the relaxed hair was phasing out, and in this location, African American or Black women, that they probably called at that time, started wearing Afro puffs, afros as a hairstyle. And Maya Angelou, she was with I think she was with some professionals within her business, or not her business, but in the performance sector. And when the lady another Black woman walked in. At this time, Maya had not transitioned to Afrocentric hair. She, I think, had her hair relaxed or pulled back, or I can imagine. And a Black woman walked in with Afro. And at that time, the white men in her company said, wow, look at her. And everyone was looking at the woman because that was a new hairstyle, not that the lady was Black. I think it was more that her hairstyle. And Maya, in the book, she says to herself, at that moment, she knew that this was a learning moment, because if she said, yeah, look at that, look at her hair, and made a negative connotation, she would have taught the white men that type of hairstyle was also a negative or not pleasing. So at that moment, Maya, and if you've ever seen Maya perform, and I can just imagine her statues, she says, yes, look at her hair. I think it's quite exquisite. So then the guy said, they kind of looked at each other like, what? But they agreed with her and went along with it, because she taught them or she helped prick their consciousness of their beliefs. And they said, well, yeah, I agree. I think it's beautiful. So then when the other white men came over to the group and they were like, you see this lady? And then the white men said, yeah, isn't it beautiful? So at that moment, she changed again, we can change the trajectory of what our generalizations and our potential stereotypes can be of other people, groups, persons, and characteristics. So yes, great book. Yeah. Wow. Okay, Susan, I hope I can share. Maya Angelou was one of her, oh, did you say she was one of your teachers in high school? Oh, I'm so, wow, to have Maya Angelou. So Susan Park shared that Maya Angelou was one of her substitute teachers in high school. Wow, that is amazing. Yes. And this is what we can do to help advance equity. Many of us, we're in positions and where we can assist with decisions that are being made, and whether it's funding or prioritizing initiatives. How are we changing the trajectory for health equity for everyone? That's part of our growth for ongoing cultural humility. What are we doing? Are we calling people out on the microaggressions? Are we calling people in at the table to assist? So those are some homework for you guys. And also participate in the leaderboard. I'm number one. So you have any additional questions or comments? Thank you, Tiffany. I like Tiffany. I can put her in my pocket. She gives me kudos and congratulates me. I like that. I like that. Have you ever met someone and you say, I get that person, or I don't get that person? It's typically, I'm big in Myers-Briggs personality typing and emotional intelligence, which helps with this work, guys, by the way. But when you meet someone with shared values and worldviews, that's when we typically say, I get you, or I like that. It's not based on something outward, but it's a reduced marginalization between two people. And within cross-sector, within agencies, that's the work that we have to continue to do, is to reduce the social marginalizations and cross barriers, connect where we are similar, and celebrate where we are different. And I'm looking at the pictures of you, I see similarities, I see differences. I see pretty things, like I see pink things, so I'm going to gravitate to the pretty sparkly things. If I see a mess, I may say, okay, I'm not going to that one. But own up to our preferences, but again, being mindful that we do not operate in those prejudices, and keep a hold of what our end goals are, and that's healthier individuals, healthier families, healthier communities, because those communities are your neighbors, they're your residents, they're your voters.